it's me, Myra. Welcome to another anatomy lesson. Today we're going to be talking about the ankle. If you haven't gone back and looked at the knee and the tibia, fibula, go ahead and do that. Orientate yourself to what we're talking about. Also, if you haven't seen the the lesson on medical terms, please go back and look at that also. It's going to help you as we continue on with our lessons throughout these next weeks. So without further ado, let's get started. We're going to be going over the ankle today. And then next week, we're going to be covering the foot. Okay? So once again, if you haven't seen the tibia fibula video, especially, go back and watch that, please, because we're going to be talking about some of the same structures in the ankle as was the tibia and fibula. The ankle joint is the most important structures when it comes to the foot and the lower leg. Without our ankle, we couldn't bend or flex our foot. We couldn't rotate our foot right, left, side to side in a circle. So the ankle is very important. So what are the structures of an ankle? The structures of the ankle include bones, joints, ligaments, nerves, tendons, and blood vessels. The top of the foot is called the dorsal surface. Top of your foot, top of your ankle, dorsal surface. The bottom, the sole part, is the plantar, because we plant our feet on the ground. That's the plantar surface. So dorsal is the one that's up, and I'm going to show you just a second. The plantar surface is the bottom of your foot, where you have your arch and your heel. That's the plantar, like you're planting your foot down of your ankle, okay? The lateral, as we know from the previous lessons, we've been talking about this the whole time we've been doing anatomy lessons. Lateral side and medial side. Lateral side is on the outside. Medial side is on the inside. So let me show you. Once again, we have the distal tibia, distal fibula. Lateral malleolus is always on the fibula side. The medial malleolus is always on the tibia side. We're going to talk about the talus, which we haven't really talked about that yet. That's why it's important to go back and review. Pardon me. And also the calcaneus, also known as the heel bone. I'm going to turn this around, and I'm going to show you what a normal ankle joint looks like. Here we joint. Going to hold this up. Let me get it. So, once again, medial side, tibia, medial malleolus, right here. The talus, our new structure we're going to be talking about. Fibula, distal fibula. So, if the fibula is there, it's got to be the lateral malleolus on this side. Here's a new word, calcaneus. That's the heel. Now, once again, if you've been following me the last couple of weeks, I have mentioned that this line, white line through here, is from my printer. I apologize. Just have to kind of roll with it until we can get that fixed. But once again, if you'll go back and review the lesson on tibia and fibula, you have more up here that makes up the knee joint up this direction. So once again, distal tibia, medial malleolus, talus, fibula, lateral malleolus, and the calcaneus. Last week I talked about the missing puzzle piece to the ankle when we talked about the distal fibula and tibia. The talus is that missing puzzle piece right here. Let's carry on. That's what a normal ankle joint looks like. So once again, the ankle joint is formed by the distal tibia, distal fibula, and the talus. The distal tibia, the bottom of the talus, is also the calcaneus, okay? So the calcaneus is going to be more of the foot, but it's going to be the heel, the calcaneus. We're going to be talking about that more in just a little bit, okay? The talus works like a hinge joint. It allows the foot to move up, dorsal flexion. So this is your foot. You can move that up because of the talus. Down, move your foot down, plantar, okay? Plantar flexion. So dorsal flexion, going up with your foot. Plantar flexion, going down with your foot, comes from your talus, the joint itself, okay? Articular cartilage also allows the bones to move smoothly with one another. These are found in the weight-bearing places like the hip, knee, ankle. They allow shock absorption. We talked about that in the spine. Go back and review those if you haven't already. Shock absorption, and lasts a long time without injury. Lasts a long time. So the weight-bearing places, the articular cartilage can last a long time if it's not injured. Now, obviously, as we age, things start wearing out. Things, deteriorate over time. But your articular cartilage kind of hangs around until it can't hang around no more, as they say, okay? So ligaments attach bone to other bones. Tendons attach muscle to bones. The thickness of these determine their strength. So the thicker the tendons are, the more strength they have, okay? One thing that we see in the heel, around the calcaneus, and the posterior ankle is the Achilles tendon. Okay, the Achilles tendon, most important for walking, running, and jumping, attaches muscles to the heel, calcaneus. It helps you tippy-toe. That's the Achilles tendon. You can tippy-toe because your Achilles tendon. There is a muscle posteriorly that allows us to turn our foot inward. Okay. Another tendon anterior also allows us to raise our foot. Let me show you what a Achilles tendon looks like. I am going to turn you around once more. Hold on. This is a normal Achilles tendon right here. Normal Achilles tendon. See, it's going up. It's a tendon coming down, attaches to your heel right there. Attaches to your heel right there. Right there. That's a normal Achilles tendon. Okay? Now let's talk about Achilles tendon problems. Okay? Achilles tendon problems. Also, before we go on to that, there's two main arteries, one anterior and one posterior. And we'll talk about those in just a second, okay? So Achilles tendon problems, tendinitis. Itis, as we've been learning this whole time, is like inflammation, a sprain, a strain. Tendinitis. A strain happens in runners, middle-aged sports players like tennis, basketball. How do you treat tendinitis? Well, you can do it with rest, ice, meds, exercise, physical therapy, stuff like that. That is also, tendinitis is also called tendinosis. And I'm going to show you in just a second both of those. Tendinosis, basically it's the same thing. Your Achilles tendon is just strained. It's tired. It's been stretched. So let me show you. Let me flip you. Tendinitis. So now you can see this was normal. Looks good all the way down. But you come over here, got a little strain going on. Little strain right there. Tendinitis. So same thing over here. Tendinosis. Let me get my papers to stand up straight. Tendinosis. It's about the same thing. Got a little strain up in here. Tendinosis. Okay. But we can also have tears. Okay. We can also have, let's talk about that real quick. Ruptured tears after being stretched too far, kind of like a rubber band. Think of the Achilles tendon or any tendon as a rubber band. If you stretch it, stretch and stretch and stretch, eventually it's going to break. That is called a Achilles tendon rupture. Achilles tendon rupture means it has been torn, stretched too far. What are some of the symptoms? Severe pain in the calf, swelling. You can't turn your foot down, no downward movement. You can't tippy toe. You feel a popping or a snapping with injury. Well, what about treatment? Well, it's ruptured. So we're going to have to kind of do a little bit deeper with the treatment on those. It can be surgical or non-surgical, okay? If you're young, surgery is probably an option. I'm going to show you a picture in a second what they do for that. If you're older, probably non-surgery, depending on if you're able to have it or not. You know, if you're medically able to have it. But both can be effective. Both can be effective. So I want to show you the rupture real quick. Here is the rupture. Can you see right there? It's broken. It is torn. The rubber band, so to speak, has stretched as far as it can go. And it is now not working. Not together anymore. Let me show you what they do for that. Let me get my, let me see, I have a picture. 1 second. Let's see. Here is a picture of a surgeon to repair the tendon. So there it is from the lateral view, the sagittal view. See how it's ruptured Achilles? Open it up from the back of the heel. It's Achilles tendon. They put little anchors there. Stitch it up. Therapy. See, post-operative means post-op means after surgery. And they have repaired it. So that is what a Achilles tendon surgery looks like. Remember, I've talked about tendons and ligaments. Let me show you what the ligaments and tendons look like. This will kind of help you also get a better feel what goes on in the ankle. So we have tendons, the tibial nerve. We've talked about the nerves all throughout the body through our lectures so far. This is a ligament. See how it's big band? All of these are kind of bunched up together, tendons and the tibial nerves. There. You also have, let me change my paper really quick. So once again, here's the tibia and fibula. These are the ligaments. You have quite a few. So posterior, inferior, tibiofibular ligament. Right there. Posterior talofibular. So it has to be near the talus, right? Posterior tibulofibular ligament. Going to follow it down. It's right here. Right there. Anterior inferior tibiofibular ligament. Right here in the front. Also anterior talofibular ligament. Right here. Anytime we have something anterior, which means there's going to be a posterior. Anytime they say anterior, we're going to have a posterior. Okay, so we'll know which direction we need to go. Once again, here's the calcaneus, the heel. This whole thing right here. So we have a calcaneal fibula because it is right there. Then we have the plantar fascia. Plantar fascia is here, right here. If you've ever had plantar fasciitis or have known someone to have plantar fasciitis, that means this fascia here has become strained or inflamed. I will tell you from experience, plantar fasciitis is not for the weak. It is very, very painful. Very painful. Most foot doctors that I've come across have you either get injections or take a tennis ball and rub it on the bottom of your foot to loosen up some of the liquid, the fascia, and try to get rid of some of the strain, the sprain, the inflammation. Now we've talked about there's a couple of arteries in the foot and the ankle. So we're going to cover those real quick. Anterior tibial artery, number 1. Let's see where it is. Anterior tibial. Lateral talar. Lateral tarsal. Tarsal. Posterior recurrent branch of the lateral tarsal. Artery of the tarsal sinus. These are the arteries that supply blood supply to the foot and the ankle. Foot and the ankle. I was going to show you also on MRI. Those that know that I am a X-ray tech. I do CT, CAT scan, MRI, and X-ray. And so every chance I get, I like to show you what it would look like anatomically on an X-ray or CT or an MRI. So once again, this is going to be your tibia. This is your talus. Your talus. Here is your calcaneus. We're looking from the side, okay? These are some of the bones in your foot. We're going to go over those next week. But the main thing that I want to bring to your attention is the Achilles tendon. Achilles tendon. Right there. Coming down. There's that long tendon. Remember, it attaches to your heel. There's where it attaches. Right there. Here is that's a normal. I just showed you. Here is a ruptured. See, it's not all one thing. It's not together. So this needs to be probably surgical intervention if the patient is able. Once again, here's the tibia. Here is the talus again. Here is the calcaneus or the heel. You can kind of see where it attaches there, but you can clearly see at the arrow that it's definitely ruptured. Definitely ruptured. Before I let you go, I'm going to show you just a couple of things more. Fractured ankles. Fractured ankles sometimes need intervention surgically. Here is a tibia, once again, fibula. So medial malleolus would be here. Lateral malleolus will be over here. It's going to be your talus. This is kind of turned a little bit. On this image, we want to see the talofibular joint right there. So we turn your ankle in just a little bit to get a better view. As you can see, there is screws here. There is plates here. Due to some kind of injury and surgical intervention had to be performed. Had to be performed. And I think I might have one more, if I can get it. I was going to show you before we leave what a dislocation looks like. Dislocation. So obviously, this is the talus. There's that little puzzle piece I was telling you last week that was missing from these two bones, the tibia and the fibula. As you can see, this should be sitting here. Fibula looks good. Talus is sitting here, but this, talus is sitting good, but the tibia is not touching. This space is too wide. So evidently they've had some kind of injury. And this ankle joint is dislocated. Dislocated means it's been moved from its normal position. That is a dislocation. A dislocation. Dislocation. I hope you've enjoyed our lesson. Come back next week and we're going to be talking about the foot. There's several bones in the foot that make up the toes. So we need to, and forefoot, hind foot. So we need to go over those. I hope you've enjoyed the lesson. Go back and once again, you need to reorientate yourself to some of the terms we're using during our lessons. Go back and do that. If you haven't seen the tib fib or even the knee or the femur or the hip, go back and look at those. We're going to be going over the foot, and then we're going to be coming back up in a couple of weeks. We're going to start the arm. Okay? Have a good night, and I'll see you on the next lesson. Bye-bye.